I'm Dr. May Sikiang. I'm an OBGYN and I'm affiliated with Makati Medical Center and St. Luke's Medical Center, BGC. These are special times. We are in this time of pandemic and a lot of women are already very anxious. If you plan to get pregnant in this time, please talk to your OBGYN first. Is this the best time to get pregnant? Are you really in a hurry to get pregnant? Are you really ready to deal with the pandemic plus pregnancy? Are you ready to handle the stress and how to go about it? Are you taking vitamins and all that? There are some patients that even if we want to delay the pregnancy, we are pressed for time. So if you talk to your doctor psychologically and emotionally, at least both of you and your husband would be ready. You can also do teleconsult. Right? So this is one of the most important platform that happened during pandemic. We are not used to telemedicine prior to pandemic, but a lot of doctors, most doctors, as far as I know, are already doing telemedicine. So you don't really have to go to your doctor and have a checkup. You can find the doctor or you can go to your previous doctor and ask if they do telemedicine so that you don't have to go out and expose yourself to danger. So at least the first checkup, you can talk to your doctor about your concerns. One of the things that you have to consider is you might want to get the vaccine for coronavirus before trying to get pregnant, because it's very important at this time that you don't get the infection. That's the priority for everyone at this point. You might want to also discuss with your doctor if you can get coronavirus vaccine first before you try to get pregnant. Once you're pregnant, again, try to talk to your doctor ASAP, because we can also do the first prenatal checkup through telemedicine. Basically, first prenatal checkup, we cannot hear the heartbeat of the baby. So we can just tell you what to expect, like nausea, vomiting, headache, dizziness, danger signs like spotting, bleeding, severe pain, what to eat, healthy food. Obviously, at the time of pandemic, when you're pregnant, we don't want you to develop complications. What are the things to avoid and what are the other vaccines that you can get during pregnancy? This can be discussed even during teleconsult. You don't have to go physically to your doctor, and the doctor can also tell you when is the best time to have your first ultrasound. The first ultrasound, though, you really have to go out. Okay, it's very rare that you will find someone who can do a home service of transvaginal ultrasound. At least we will limit your exposure. Again, you can also talk to your doctor if the hospital that your doctor is affiliated with has an ultrasound already. You can do it the same day. You do the ultrasound, then you go follow up right away. At least you go out only once. And then after that, the doctor will tell you the next things that you have to do. So usually, we will also require you to have some laboratory tests. After the first prenatal checkup, the next ultrasound usually, if no problems in between, is on 5th month, which is congenital anomaly scan. So what will happen in between? You won't be able to hear the heartbeat of the baby. If you don't see your doctor, you might get anxious. Luckily, we have fetal Doppler available online. So what I tell my patient is, you can buy the fetal Doppler. I will teach you how to use the Doppler so that every month when we see each other, even through teleconsult, you can listen to the heartbeat of your baby. Second, we need to monitor your weight. That's easier. You can buy a digital weighing scale. Then during teleconsult, we'll ask you how many pounds did you gain. So if the pregnancy is uncomplicated, we can do most of the prenatal checkup through teleconsult. So also in between, we can also do non-invasive prenatal testing. That's also a blood test, which the result can also be discussed online. Then on the 5th month of pregnancy, you will see the gender of the baby. We will check all organs of the baby, how many fingers, how many toes, most importantly, the internal organs, heart, lungs, kidneys, nose, lips, eyes. It will be seen on that ultrasound. And again, that is the time that you have to go out of your house and have it done. Sometimes teleconsult is not enough because there are things that we see with the patient clinically. We see it better when we see you in person. And then you will have more monitoring for your baby, like more ultrasound or even non-stress tests or more blood tests, or we might refer you to an endocrinologist to manage your diabetes, to a cardiologist if your BP is really very high, to a perinatologist, which is a high-risk pregnancy OBGYN. Now, if you give birth preterm, we will have to refer your baby to a neonatologist. More than anything, please do not get COVID during pregnancy, because this whole time that you get COVID during pregnancy, we don't know yet the full effect to the baby. So we don't know if it will trigger preterm birth. In fact, any infection can trigger preterm labor. So even at home, if you can do social distancing or even wear mask, please do, especially when you're pregnant. Because again, if you get COVID, it will complicate everything. You will panic. There's also nothing we can do. There's no medication, real medication that can stop it right away. So some patients will really have it bad. Remember, when you're pregnant, your immune system is already compromised. So having COVID during pregnancy, aside from you're anxious for yourself, you are also worrying for the baby. So before you try to get pregnant, make sure that you are ready psychologically, emotionally, physically, and mentally.